Good morning, students. This week I'm going to introduce our topic of how to perform a blood pressure tutorial video. So first of all, I'd like to introduce our equipment. All of you by now should have your own equipment because you have picked it up from school or you have purchased your own. So of course I have a stethoscope, okay, and I have a blood pressure cuff. You need these two things to start it out. So make sure you have your supplies ready. Good morning, I'm Bernadette. I'll be your nurse today. Normally, I would be having my patient identify themselves, but today I'm going to be introducing my patient as Sarah, and she's been kind enough to volunteer to have a blood pressure performed on her during a tutorial. May I have your arm, Sarah?
Yep.
By her giving me her arm right now, it's called implied consent. Remember that for certification. Would you roll up your sleeve for me so I can perform an accurate blood pressure? Before I place the cuff, I need to identify and locate the brachial artery. So most people, it's close to the body. You're looking and feeling for a pulse. And I have found it right here. So now I'm going to place my blood pressure cuff. And on this particular blood pressure cuff, I have one arrow. So this one arrow is going to be placed over the brachial artery, 2 inches above the fold of the arm. In some other blood pressure cuffs, there might be 2 arrows indicating a left and right arm. So you would place that appropriately. So I am using her right arm, and it really doesn't matter in this one because there's one arrow. So I remember where it was. And I can feel again if I like. And I'm going to place this right here. And you're also going to make sure that it's not too loose. So I have about 2 inches there in between my fingers, the skin, and the blood pressure cuff. So my next step is to make sure that the stethoscope is in properly. So you need to make sure that the earpieces go into the hole areas, not the opposite way in which it would be in the back of your ears. So I'm going to place my stethoscope in, then I'm going to tap that diaphragm to make sure that I can hear it. If I can't hear it, then it needs to be turned. So in this case, I can hear it, so I tapped it again and I'm ready to listen for a blood pressure. So now I'm going to place my stethoscope over the brachial artery. I am going to roll up the bulb towards the patient. And notice that the patient's arm is nice and comfortably placed on a table, so it's just not dangling over. So I'm going to roll up towards the patient. Then, because I don't know her baseline, I'm going to pump this up to 160. I'm going to slowly deflate it, but not too slowly because I'm keeping in mind the circulation of the arm. And I'm waiting to hear the first sound. And then the last sound. And then release it completely down to 0. And I got 124 over 80 millimeters per mercury. I'm going to remove the cuff and thank my patient. Thank you, Sarah.
You're welcome.
And then I'm going to document. Okay, Sarah, well, your blood pressure is 124 over 80, and I know you're here for a physical. And do you have any other complaints?
Nope.
Okay. Well, the doctor will be in to see you.
Okay.
Come in.
Hello, hello. How are you doing today? Sarah, right?
Yep.
All right.
What's happening? What is she here for?
Well, Sarah's here for a physical.
Okay.
Her blood pressure is within normal limits, 124/80.
That's outstanding.
Just wondering, did you want me to do an EKG on her since she is here for a physical?
Yeah, that sounds good. If that's okay with you, we're gonna get an EKG done, make sure everything's in rhythm, everything's working correctly. Is it okay if I just check out your heart and lungs real quick?
Yep.
All right. You can sit back for me. Move forward a little bit. Deep breath. Two more times. One last time. All right, everything's sounding good. Your heart seems in good shape. We're gonna get that picture of your heart done. Your lungs sound great. No wheezing, nothing like that. Pretty healthy. Have you any complaints or anything you want to talk to us about today?
Nope.
All right, just get this done. The order's done and we'll be good. All right, get you out of here.
Okay, thank you, Dr. Perez.
Thank you.
And just to recap, 124/80 was Sarah's blood pressure. I know that it's normal because the systolic blood pressure should be in the range of 100 to 140 millimeters per mercury. The diastolic should be 60 to 90 millimeters per mercury, so therefore making 124/80 was a normal blood pressure.